Depression, what it is, its impact, and management and treatment options. According to the Mayo Clinic, depression is a mood disorder that causes a persistent feeling of sadness and loss of interest. Also called major depressive disorder or clinical depression, it affects how you feel, think, and behave, and can lead to a variety of emotional and physical problems. You may have trouble doing normal day-to-day activities, and sometimes you may feel as if life is not worth living. Depression is also associated with many other illnesses, some of them being anxiety disorders, panic disorders, social phobias, and generalized anxiety. Together, these conditions affect millions of Americans. Depression has many economic, social, and emotional impacts as well. Some of the economic impacts are that $210.5 billion are lost per year due to serious mental illnesses. Depression is also the leading cause of disability in the United States among people ages 15 to 44. Depression also ranks among the top 3 workplace issues in the United States, along with family crisis and stress. Some treatment impacts are that 80% of those treated for depression show an improvement in symptoms within 4 to 6 weeks of starting treatment. 2/3 of people with depression do not actively seek nor receive proper treatment. 41% of adults in the United States with a mental health condition received treatment in 2015, and 51% of children ages 8 to 15 with a mental health condition received treatment in 2015. Some research funding statistics are that of 1 in 5 Americans will be impacted by mental illness during their lifetimes. Breast cancer is the top funded disease and receives more funding than the top 3 deadliest diseases combined. We lose about as many people to suicide each year as we do breast cancer. Depression receives 1/10 of the funding of motor neuron disease and only 1/100th of the funding that breast cancer receives annually. Suicide is the second leading cause of death for ages 15 to 44. There is 1 death by suicide every 12 minutes in the United States. Deaths by suicide in the United States in 2014 was at a total of 42,733. 250,000 people become suicide survivors each year in the United States. 22 veterans lose their lives to suicide every single day. Veterans ages 50 to 59 have the highest rates of suicide. Only half of all returning veterans who need mental health treatment actually receive it, and the rate of PTSD among veterans is 15 times higher than civilians. Depression comes with many symptoms. Some people feel more and some people feel less, but some of the most common ones are feelings of sadness, tearfulness, emptiness, or hopelessness, sleep disturbances, including insomnia or sleeping too much, reduced appetite and weight loss or increased cravings for food and weight gain, anxiety, agitation, or restlessness, feelings of worthlessness or guilt, fixating on past failures or self-blame, and unexplained physical problems such as back pain or headaches. Depression symptoms vary from person to person. In younger children, symptoms of depression may include sadness, irritability, clinginess, worry, aches and pains, refusing to go to school, or being underweight. In teens, symptoms may include sadness, irritability, feeling negative and worthless, anger, poor performance or poor attendance at school, feeling misunderstood and extremely negative, using recreational drugs or alcohol, eating or sleeping too much, self-harm, loss of interest in normal activities, and avoidance of social interaction. Depressions in older adults looks like memory difficulties or personality changes, physical aches or pains, fatigue, loss of appetite, sleep problems or loss of interest in sex, not caused by a medical condition or medication, often wanting to stay home rather than going out to socialize or do new things, and suicidal thinking or feelings, especially in older men. So what exactly causes depression? There are many causes to depression, such as abuse from loved ones, certain medications like acne medications or birth control, conflict, death or a loss, genetics, having a family history of depression, major events such as moving or losing a job, other personal problems such as social isolation due to other mental illnesses, serious illnesses, and substance abuse. So when somebody realizes that they do have depression, they have all the feelings, have all the symptoms, how do they manage it and treat it? There are many different treatment strategies for depression, such as psychotherapy, family or couple therapy, hospitalizations, self-help strategies, or different kinds of medications. Psychotherapy is a general term for treating mental health problems by talking with a psychiatrist, psychologist, or other mental health provider. During psychotherapy, you learn about your condition and your moods, feelings, thoughts, and behaviors. Family or couple therapy is a type of psychological counseling that can help family members improve communication and resolve conflicts. Family therapy is usually provided by a psychologist, clinical social worker, or licensed therapist. Hospitalization may become necessary when it is deemed that a patient has become a danger to himself or others. It may involve different therapies and medication along with outpatient programs. Medication is a very common treatment when it comes to treating depression. There are many different medications that can help reduce the symptoms of depression, such as different kinds of antidepressants and inhibitors such as monoamine oxidase inhibitors, selective serotonin reuptake inhibitors, serotonin and norepinephrine reuptake inhibitors, and norepinephrine and dopamine reuptake inhibitors. Self-help methods for the treatment of depression may be helpful for someone who is unable to access professional resources for someone to help with mild symptoms. Some different kinds of self-help strategies are support groups, online resources, and self-help books. Some different help hotlines, if you or somebody you know is struggling with any of these issues, are Dating and Abuse and Domestic Violence Hotline, Suicide and Depression Hotline, Eating Disorder Hotlines, General Crisis Hotline, Mental Illness Hotline, Sexual Assault Hotline, and Veterans Crisis Hotline. All students at ESU also have access to counseling services. The Student Wellness Center Counseling Services provides counseling for ESU students via Zoom for healthcare. If you or someone you know needs help, do not be afraid to reach out and get them the help that they deserve.